Effective immediately, all P-12 schools and daycares in Illinois must follow the CDC guidance of universal masking inside, regardless of vaccine status.
It's big news as the school year starts. Governor Pritzker issued new mask rules for all students and staff inside classrooms. Good evening. I'm Jessica Coons.
And I'm Jennifer Roscoe. The updated mask mandate comes as doctors warn the Delta variant is infecting younger people, especially indoors, and spreading faster than previous strains of the coronavirus. We have team coverage for you. WCIA3's Capitol Bureau Chief Mark Maxwell is live in Springfield. Jamie Mays is live in our newsroom. First to Mark. Doctors still say you're protected if you have the vaccine, but you can spread the virus.
Jennifer, that may be one reason why we're just not seeing the sheer number of people hospitalized with COVID-19 now, as we saw back at earlier stages like this before we had the vaccine, when infections were surging. Still, even while those COVID hospitalizations represent a mere fraction of all the people in hospitals today, that number is rising, tripling in the last month. And we know that it's who is going to the hospital, younger people in particular, that has doctors raising concerns.
Every time we think we know where this virus is headed, it changes and it shifts.
Governor Pritzker cited a rise in younger people becoming more severely ill with the coronavirus at a Wednesday press conference, where he issued a new statewide mask mandate for schools and required some state workers to get the vaccine.
Illinois will require vaccinations for all state employees who work in congregate facilities such as our veterans' homes, our corrections facilities, and the Department of Human Services developmental centers and psychiatric hospitals.
The state's largest public sector union said they've worked to educate and encourage union members to be vaccinated, saying, quote, "We strongly oppose any effort to define them as part of the problem." When the CDC left mask rules optional, some school districts lifted them entirely. Others, like Springfield, kept them in place.
We all understand why we need to wear masks, and we're teaching the students why they need to wear masks.
Springfield Public Schools already passed rules requiring masks indoors. While they have not yet required teachers to get the vaccine, they are asking them if they got the shot.
If somebody does not wish to answer the question, we'll consider them unvaccinated. We are asking for that, asking them to upload their card, but we're not mandating that.
We're looking at mandated vaccines.
Dr. Doug Carlson is the medical director at St. John's Children's Hospital. He said hospital attorneys are already considering mandating vaccines for all hospital employees.
There are consequences to not getting the vaccine. Those consequences are potentially harming others.
Carlson said in the last 2 weeks alone, 12 children came to the hospital with the coronavirus. He's urging people to take this more seriously.
If you're choosing not to get a vaccine, take care of yourself and others by wearing a mask.
Carlson shooting down misinformation from skeptics who sow doubts about whether masks work, and said just because some people might have felt comfortable with the risks of the coronavirus last year, this time around is different.
So it is spreading very quickly among kids in congregate groups, like the initial variants did not. So that what we know that in unmasked situations, it's spreading quickly among the kids and adolescents.
Governor Pritzker's office telling me tonight they do have the legal authority to enforce that mask mandate for public and private schools. Some school districts may opt to test that in court. But what about mask mandates for private businesses or capacity limits? Governor Pritzker saying those tools are outdated for the world we live in today. The best tools we have to fight the pandemic, he says, are the vaccines. Reporting in Springfield, Mark Maxwell, WCIA3, your local news leader.
All right, Mark, thank you so much for that. Now,